Good evening, friends. Today I am going to talk about tuberculosis. Let's see about tuberculosis. Tuberculosis is a serious illness that affects the lungs. Tuberculosis can spread when a person coughs or sneezes to the next person through tiny droplets with germs into the air. Usually, tuberculosis spread where the people gather in crowds or people living in crowded places. People with HIV or AIDS and with weakened immune system have a high risk of having tuberculosis. Tuberculosis germs survive and multiply in the lungs. It is called TB infection. Primary TB infection. First stage of primary infection. Immune system cells find and capture the germs. The immune system completely destroys the germs, but some captured germs may still survive and multiply. Most people don't have symptoms during a primary infection, but some people may get flu-like symptoms such as low fever, tiredness, and cough. Latent TB infection. Primary infection usually followed by the stage of latent TB infection. Immune system cells build a wall around the lung tissue with the TB germs. The germs can't do any harm if the immune system keeps them under control. But the germs survive. No symptoms are found during latent TB infection. Active TB infection. It happens when the immune system can't control an infection. Germs can cause infection throughout the lungs or other parts of the body. Active TB disease may happen right after primary infection, but it usually happens after months or years of latent TB infection. Symptoms of active TB infection: cough, coughing up blood or mucus, chest pain, pain with breathing or coughing, fever, chills, night sweats, weight loss, not wanting to eat, tiredness, not feeling well in general. Active TB disease outside the lungs. TB infection can spread from the lungs to other parts of the body. This is called extrapulmonary tuberculosis. Symptoms vary depending on what part of the body is infected. Fever, chills, night sweats, weight loss, not wanting to eat, tiredness, not feeling well in general, pain near the site of the infection. Common site of active TB disease outside the lungs include kidney, liver, fluid surrounding the brain and spinal cord, heart muscles, genitals, lymph nodes, bones and joints, skin, walls of blood vessels, voice box also called larynx. Active TB disease in children. Symptoms of active TB disease in children vary. Typically, symptoms by age may include the following. Teenagers. Symptoms are similar to adult symptoms. 1 to 12 years old. Younger children may have fever that won't go away and weight loss. Infant. The baby doesn't grow or gain weight as expected. Also, a baby may have symptoms from swelling in the fluid around the brain or spinal cord, including not active, unusually fussy, vomiting, poor feeding, bulging soft spot on the head, poor reflexes. Causes. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis. People with active TB disease in the lungs or voice box can spread the disease. They release tiny droplets that carry bacteria through the air. A person can get an infection by inhaling those droplets. The disease is more likely to spread when people spend a lot of time together in the indoor spaces. So the disease spread easily in the places where people live or work together for a long period of time. Also, the disease spread more easily in the crowded places. A person with a latent TB infection cannot pass the disease to other people. A person taking drugs to treat active TB disease usually can't pass the disease after 2 to 3 weeks of treatment. Drug resistant TB. Some form of TB bacteria can become drug resistant. This means that the drug once cured to cure the disease no longer work. This happens in part because naturally occurring genetic changes in bacteria. Risk factors. Living with someone with active TB disease. Living or traveling in a country where TB is common, including several countries in Latin America, Africa, Asia, and Pacific Islands. Living or working in places where people live close together, such as prisons, nursing homes, and shelters for homeless people. Living in a community identified as being high risk of tuberculosis. Working in healthcare and treating people with higher risk of TB. Risk of active TB disease. A weakened immune system increases the risk of active TB disease. Conditions that weaken immune system include HIV or AIDS, diabetes, severe kidney disease, cancer of the head, neck and blood, malnutrition, cancer treatment such as chemotherapy, drugs to prevent the rejection of transplanted organs, long-term usage of prescription steroids, use of unlawful injected drugs, misuse of alcohol, smoking and using other tobacco products. Age and active TB disease. Under 5 years of age, age 15 to 25, age 65 and older. Prevention. If you have a serious infection of TB, then stay at home. Isolate at home by sleeping in separate room. Ventilate your room. Wear face mask. Cover your mouth. Thank you. If you want more information, please like, share and subscribe my channel. Thank you.